welcome to the Healthy Woman Podcast with your host, Payton McWilliams, physical therapist with a passion for treating women throughout all chapters of their life. Join me as I share about breast cancer recovery, pelvic and peripartum health, and fun topics related to women's lifestyle. I want to tell you about my favorite products, teach you some things, answer your questions, and talk all the things. Please remember that the content in this podcast is intended for general information only and should not be considered medical advice, diagnosis, or treatment. Please discuss with your healthcare provider if you have any questions pertaining to your health or situation. I'm excited to start this journey with you, so let's get started. Hi everyone, welcome to episode 2 of the Healthy Woman Podcast. This episode is about breast cancer related lymphedema. So today we're going to talk about why and how lymphedema develops following breast cancer treatment, the risk factors associated with lymphedema after breast cancer treatment, as well as what to do, what not to do, how to prevent, and how to manage breast cancer related lymphedema. So let's dive right in and get started. So in the first episode, we talked about breast cancer treatment and how each treatment is different depending on the breast cancer type and your oncology team, of course. However, the research shows that no matter what treatment you have, whether that is chemo, radiation, surgery, hormone therapy, they all play a very small role in damaging the lymphatic system, unfortunately. So if you have surgery, which most patients have some type of surgery, either including a sentinel lymph node biopsy or an axillary lymph node dissection. So the difference between those two things, a sentinel lymph node biopsy, is that they just take the first 1, 2, maybe 3 lymph nodes outside the breast, essentially the gatekeeper lymph nodes, before you actually get to the full lymphatic system. They pull them out, they send them to the pathology, and they look to see if the cancer from your breast has metastasized into those sentinel lymph nodes. So that's what a sentinel lymph node biopsy is. Now, an axillary lymph node dissection includes a little more damage. That is usually between 5 or 30 lymph nodes. So that's a bigger number, and it's usually from farther along that axillary region. That just means anywhere from under the armpit and under the arm. So taking anywhere from 5 to 30 lymph nodes, it's quite a big range, right? That puts a lot more stress and damage on your lymphatic system than just the standard sentinel lymph node biopsy. That is usually due to some reason involving metastasizing into your lymph nodes, your lymphatic system. So that's the case that you're going to encounter with an axillary lymph node dissection. And the reason I bring those two dissections up is because that's really the main indicator of your risks, and then the risk profiling kind of goes from there. But the number of lymph nodes you have removed really does determine how much risk are you at with developing lymphedema following breast cancer treatment. Those lymph nodes really are the bread and butter of this whole problem. So from the breastcancer.org website that I like to reference, they do report an incidence rate of anywhere between 5 and 17% patients who have sentinel lymph node biopsy, 5 to 17% develop lymphedema. Now, those patients who have axillary lymph node dissection, again, axillary lymph node dissection is anywhere from like 5 to 30 lymph nodes. Their incidence rate for lymphedema is 20 to 53%. So if anyone has more than 5 lymph nodes removed, their risk for developing lymphedema or swelling in their arm or chest is 20 to 50%. Quite the range. So why such a big range? What else goes into this? Because there's clearly some ambiguity here in the research and the risk profiling for patients developing lymphedema. So other risks that go into the development of lymphedema include things like, again, the breast cancer treatment that you have, chemo, surgery, how many surgeries, the type of tumor you have, how big it is, where is it, as well as, radiation, how long is the radiation for. But then things outside your cancer treatment that provide a risk include your age, your skin integrity and skin quality, body fat percentage, BMI, the amount of muscle that you have in your body, your activity level, what kind of other comorbidities do you have, like high blood pressure or kidney or cardiac problems, Do you have a history of infections? That plays a role in the development of lymphedema. Things like that are, present before the breast cancer treatment and kind of irrelevant of the breast cancer treatment. So those all play a role in your development of lymphedema, which is why the onset and the incidence is kind of all over the board, right? There really is not a ton of research that can tell you what your true risk for developing lymphedema is. And that's why we're trying to grow the body of evidence and grow an educational platform. So let's say, you have breast cancer treatment and you know that you're at risk. So what other things should you avoid to further prevent the onset of swelling or lymphedema? Things that can trigger swelling include repetitive upper arm activities. That's the big thing that the academies like to say, repetitive upper arm activities. So that includes things like golf, tennis, painting, carrying, lifting, heavier things, gym activities, specifically like, overhead weights or upper body weights, or even running. Any of those things can be a risk factor for lymphedema because they bring on blood flow to the body, and blood flow is normal and is healthy, and you want blood flow to increase with activity. However, with blood flow, some blood leaks out of the circulatory system, and the lymphatic system picks that up and creates lymph from the blood that leaks out of your circulatory system. That and some other things. But the point is, the more blood flow you have, which is normal and healthy with activity, the more lymphedema or the more lymphatics you have to filter through your nose, which then puts your body at increased risk for swelling if it is at a decreased efficiency. Other things that can cause lymphedema or swelling to occur include heat, sunburns, anything really that's hot baths, hot water, heating pads. Those are all things you want to avoid because they will bring on blood flow and thus bring on additional lymph for your lymphatic system to carry away. Anything that pierces the skin, so think blood draws, infusions, shots, injections, vaccines, anything that breaks your skin, especially tattoos. That's another big one, is getting tattoos in the involved area. Those are all no-goes for lymphedema. Blood pressure on the involved arm you want to try to avoid because of the tourniquet effect. Additionally, aggressive massage to the involved arm or the involved quadrant you want to avoid. Again, bringing on blood flow. Mosquito bites or any kind of bug bites, bee stings, that's something that you're going to want to avoid. And if you do have, you want to manage and prevent it, as soon as possible. A dog or cat scratches, any dogs that, bite or play scratch or play jump, those things break the skin, and you want to avoid that damage to the skin, to the body. Carrying anything that's too heavy for too long of a time, or repetitively lifting or carrying, like boxes, for example, if you're in the middle of moving, or if you have a toddler or a grandchild that you watch and you're regularly carrying a baby or a toddler in your arm, or if you travel a lot and you carry your briefcase on the right side every time because you're right-handed. Those are all things that you want to be mindful of and avoid to prevent essentially the onset of swelling and lymphedema. Now, I know it sounds scary. It's like, wow, what can I do on that arm? It seems like I can't do anything without the fear of lymphedema occurring. And that's not the case either. We want you to be able to go back to your prior level of function, pre-breast cancer treatment function, and do whatever you want, essentially. That's my goal. You don't need to be afraid of doing all these things by any means. You can definitely do them, but they are things that we know can trigger swelling if your body is at damage. So what do you do to avoid that? Maybe it's a matter of modifying the amount that you carry, or switching arms, or the duration that you carry, or maybe it's a matter of compression garments to help reduce swelling while you do those activities. Maybe it's including something like the self-manual lymphatic drainage. We'll talk about that later, or other methods of management to prevent swelling. So it's not a matter of avoiding the activity altogether. It's just being mindful of the symptoms that can occur, looking out for your body's response, and gradually strengthening it to withhold those forces and those stressors without swelling. It really is about finding a happy medium between not doing too much, but also not doing too little in regards to managing your swelling and lymphedema risks. So we've already talked about, risk factors and what not to do, what to avoid, but what kind of things can you do to prevent the onset of lymphedema? So the first thing that you can do is to find a healthcare provider, either a PT or an OT, and maybe your MD, who is a certified lymphedema therapist. This is someone who has gone through extensive additional training, and they can be a great resource for you to assess your personal risk profile. They can look at your medical history, look at your cancer treatment, look at your other comorbidities, and they can really explain to you your risks and what you should be more mindful of. After that, they can help you develop a prevention plan, essentially, or a management plan in regards to your lymphedema. This may include things like a compression sleeve or a compression garment. The reason that you wear a compression sleeve or a compression garment is to help reduce the onset of swelling in the involved arm. Typically, it's worn from the wrist to the upper arm, like to your underarm, and it's usually only worn while you're doing a high-risk activity. So those are the things that we mentioned above: running, walking in the sun, being in the sunlight, exercising, gardening. Those things you definitely want to wear your compression sleeve for. Or if you have swelling already, maybe you're wearing a compression sleeve at a higher compression to maintain and prevent additional swelling from going on. So in regards to compression garments, you want to be mindful of a few things that include not ever sleeping in your garment. You never ever want to sleep in the garment. You don't want to put at risk a tourniquet effect. So while sleeping, if that garment was to roll down and become very tight in one area, that is no good. So no sleeping in your garment. The other thing that you want to be mindful of is you never want to order a compression garment online without being appropriately fit by someone who is certified and has extensive training in fitting and measuring for these garments. If you get a garment that is the wrong size, the wrong compression, the wrong fit, it can do more damage than it can do good. So please do not just go on Amazon and order the first garment that you see. Please make sure you see a healthcare provider to get the appropriate fit garment for you. I'll put a link in the resource also from Juzo. Juzo is one of my favorite brands of compression sleeves and garments. They have a kind of like a directory of providers in the area that you can put in your zip code, and they will show you who sells their products and who is certified to fit and measure for their products. So other things that you can do to actively be involved in the prevention of lymphedema is walking. Walking is incredibly beneficial. It's one of the best things that you can do for lymphedema management and prevention. Some people say it is a risk factor in itself, which is just ironic. And I guess it's true, if you're walking out in the sunlight, or if you're walking, power hour in the peak of the day with, bright sunlight and no shade. But walking is actually very beneficial for lymphedema management because it helps the body move and bring fluid and lymphedema back to the heart. So if you are going to go walk and you're at risk for lymphedema, I will say it is best to wear a compression sleeve. It's also, a good idea to go in the shade or to go in the early morning or the late evening where the sun is not out and there's not as much risk for sunburn. But regardless, anything as simple as half a mile to 3 or 4 miles a day is incredibly beneficial. Again, specifically if you were to be wearing your sleeve while you're walking, just to be extra cautious and prevent any additional swelling. The last thing I want to discuss about how to proactively prevent and manage lymphedema is SelfMLD, or MLD in general. So MLD stands for manual lymph drainage. It is part of complete decongestive therapy, which is the gold standard for treating lymphedema. Manual lymphatic drainage is not massage. It looks very similar to massage. A lot of patients will call it massage anyway, but technically it is not massage. Manual lymphatic drainage is a very light, very gentle skin stretching technique to essentially push the fluid and move the lymphatic system along the body to drain into the heart. So it kind of offloads the system and it does not make it work as hard, and it helps return fluid back to the heart. So manual lymphatic drainage, we try to teach it to almost all of our patients, especially those who go through radiation and who are at a greater risk, because again, it can help prevent and offload that lymphatic system. So by the patient doing this self-manual lymph drainage every day, it can really benefit them in the prevention of any swelling from occurring. I would recommend finding a provider, a PT or an OT who is a CLT. That way they can help you appropriately learn the self-MLD steps and techniques and sequences. The other thing to highlight with this self-massage or SelfMLD, whatever you want to call it, is that it will be different for each person. The majority of the people will be able to go to the opposite side of the affected chest. So let's say, for example, you had left side breast cancer, no other problems involved in your body, just the left-sided breast cancer. Then you would massage your body essentially from left to right to push the fluid to the right side of your body to be filtered on the right side. Now, some people have other scars or other surgeries. Go into the routes that you choose to redirect the lymph fluid, which is why it's so important to meet with a lymphatic therapist to determine what the best route will be best for you. Some people who maybe have breast cancer before, and this is a second round of breast cancer for them. So let's say you had breast cancer on your left side 10 years ago, and now you have breast cancer on your right side. Then you generally do not move the fluid, and you don't massage from the right to the left side because that left side is damaged. It's at risk, right? You don't want to overload it and cause swelling on the left side. But then what do you do with the fluid that's on the right side of your body? You have to find another place for it to go. So that's why it's so important to meet with a therapist to determine the best pathways, essentially, for you to do your SelfMLD.
All right, so that concludes our episode. I hope that information was helpful. I will go ahead and link some resources in the show notes below, so be sure to check that out. It'll include where to find a Juzo dealer or someone who is certified in measuring and fitting for compression garments. I'll also link where to find a lymphedema therapist and just some links to research indicating the different risk factors for lymphedema and the correlation. I appreciate you guys for listening, and stay tuned for episode 3.